getting into my skin. That's our focus this Tuesday morning, as it is every Tuesday morning. And we say good morning to Dr. Andrew Ford, our dermatologist. And it's we're talking about, macular well, hold on a second. What was that word
I am
again?
so glad he would laugh at me if I didn't get it right.
I'm seeing it for the first time.
Progressive macular hypomelanosis is what it
Oh,
looks like to me.
you're absolutely correct. That is correct. Yeah.
Yeah.
Perfect. Congratulations.
Thank you.
Okay.
I'll take that and go.
She studied that one, boy.
No, not really. This one was easy.
Yeah, this one is much easier, and
Yeah.
you did very well with it.
Thank you. So let's define exactly what this is.
Yeah, it's a significant condition that occurs very often. The hypomelanosis refers to lightening of the skin. The progressive macular is just a description of the condition, even though it's not. It's a kind of a misnomer because it doesn't naturally progress forever. But the macular part just means flat white spots. So the pictures really tell the story of what it is. It's a condition that affects younger people in the teens to really up to 40, and then it tends to disappear. Here you can see the back of a patient with it. These hypopigmented oval discolored areas that are joined together in the center or confluent in the center, but to the edges it just looks like little light spots.
Is this the same? No, these are two different
Yeah,
photos.
two different photos, yes.
What is this just the color on that one?
Yes,
or is
it's the exposure from the photo.
Okay.
One was taken years ago and one was taken more recently, so my expertise changes over time.
Improved, yeah, we can see that.
Yeah. But it's very common. It's predominantly seen in women and a great causes a lot of discomfort in women. You can understand. You want to put on your bikini, you have all these light spots on the skin. So it's important because it's often misdiagnosed. And here's a close-up of it. You can see these hypopigmented spots, lighter spots that are kind of circular. But the spots have no dryness on them, like the fungus we talked about last season, and it isn't totally depigmented like vitiligo or any of the other lighter conditions we've talked about recently. So it's a cause of great misdiagnosis. Here it is just under the breast. That's another area that's characteristic for the condition, but it's very vague and subtle. But when you're into going into the sun and getting a bit darker, then you notice it more significantly.
I would think that on darker complexions it would be more noticeable.
Yeah.
Yes.
You said it's more common in women. Do you know why it happens?
Well, it may be hormonal, but maybe it is that women are more concerned about their skin and report to their dermatologist more often. The subtlety of it is really shown here just on the armpit. You can see that there are lighter and darker areas, but you can't really tell exactly what's going on. This is a young lady of Chinese descent. But it occurs in all age groups, especially the people with darker skin, but it can occur in all skin types from type 1 to type 6.
But it doesn't look as though it is anything that you'd be very concerned about.
Well, you'd be concerned about if you're going to expose your midriff.
If you're self-conscious.
Yes.
So
the one on the left shows the oval shape to perfection, while on the right it's more joined together or confluent. Yeah.
Okay, so how easy is it to treat this?
Well, it does take several months to treat it. It's really difficult to treat. The difficulty with the treatment is misdiagnosis. And this one was just put in to show that guys do get it. And this is a picture of a young boy and also of an older, an adult male. But on the right, it's very hard to see. You just notice that the skin doesn't look totally even, but you can't really tell what's going on. It's because his macules are very small.
So this many people probably just go along with this.
Most people think it's
just how
liver
my
spots.
skin is.
Yeah, most people think it's liver spots. So it's often misdiagnosed by doctors and also dermatologists because the diagnosis of it is totally clinical. But the important factor is that there's no dryness whatsoever in this condition. And the lighter spots tend to be only on the center of the body, on the trunk.
Right.
So they'll be more towards the midline and stretching out, but it hardly ever reaches the neck or reaches the beginning of the arms or any of the...
Or the thighs.
Yeah.
So doesn't the liver spots, though, don't they look more ashy and
Yes,
slightly
well,
different?
if you take your fingernail and rub them, you see flaking or dryness. But with these, there's no discernible difference in the surface of the skin. It looks perfect. It's just that it's a different color. So the cause of it has been a great has been a cause of great discussion, and they believe that it has to do with a bacteria called P. acnes. That's the bacteria that's also involved in acne, and when you do a Woods-like exam of people with this condition, you get a red fluorescence. So this bacteria is thought to be related to the condition, but also it has to do obviously with some hormonal factors and also genetic factors, because initially when they did biopsies of people with it, the lighter skin and the darker skin both looked normal, and it just seemed like there was some sort of what you call mosaicism. I mean, if someone is mixed, because we're all kind of mixed to some degree with different races, the mixture in the races, it was thought this was a manifestation of that mixture of the races.
Okay.
What long-term effects, though, could this have if gone untreated?
Well, if you don't treat it, probably by 40, I find if you get fat, or if you, as you get older, if you get fatter, it tends to go away. So
it tends to grow with you?
To go away.
Oh, go away.
Yes, you don't see middle-aged people with it at all. It's usually a condition seen in very fit young females and also in young men.
This is a very strange thing.
Well, that's an observation that I...
Not that you're saying get fatter to get rid of this thing if you have it.
No, definitely, definitely.
Right. So you mentioned treatment. Is it oral? Is it topical?
Well, there are different approaches. The minimal treatment you can have is like 1% clindamycin, which is an antibiotic, so you're trying to kill the bacteria. You can also use benzoyl peroxide, which is bacteriostatic, meaning it kills a certain degree of the population of the bacteria, but light treatments are very important. So ultraviolet A and ultraviolet B are also used to treat it, something called Narban UVB. But the thing is, in our location, we don't really have these specialized light treatments. So being in the sun for a little bit every week does help. But the main treatment that works very well is oral antibiotics. It usually has to be taken for at least 3 months. 3 months to 4 months.
That's a long time.
Yeah, the treatment is very long. It's just like how you'd have a treatment for acne. If you had bad acne, you were on antibiotics.
I know.
And actually a small fraction of the individuals with the condition do have acne because the same bacteria is related to acne.
Okay, so when you get that treatment, then if, say, you have to do the course of antibiotics, then they can sometimes have an effect on the body, then...
Well, antibiotics are usually very well tolerated. It's only in the case of some women, the antibiotics can predispose you to yeast infections. Also, if you may have some specific allergy to the medication, then it might manifest itself. But the thing is, there are different options, and it's a very inexpensive treatment. The hardest part is the diagnosis. And as I said, the misdiagnosis with so-called liver spots or pityriasis versicolor, and also certain types of vitiligo can look like that, and other things. If you have a condition that's causing inflammation, you can get lightening of the skin. But with this, the history that the patient presents, there's no history of any redness or any inflammation whatsoever. So that's something that helps to distinguish it from other conditions.
Totally unrelated question. I have to ask it, though. Most of your patients will be female.
Well, predominantly, I would say that's the truth.
Well, I asked that question because there are lots of conditions that I see that men have that they don't seem bothered about. You know, you see something on this. What's it? Some little thing. You know. And men don't seem to pay attention.
Yeah,
to
men
a lot of these conditions.
are kind of If it's not going to kill you, a guy probably won't go to the doctor.
Okay. So that situation then is completely treatable. May take up to about 3 months.
It may take 3 months minimum, but it can take up to 6 months. But the important thing is that the oral treatment and the light treatment tends to work the best.
Okay, no itching or anything? Does it
No,
get worse
it's
with
totally
the heat?
asymptomatic.
No? Okay, so it just sits there peacefully. If it bothers you aesthetically, then you go see your dermatologist. But this has been an interesting conversation. Thank you very much for sharing. Now you know.
It's great being here.
Now you know.
Always a pleasure. Happy Tuesday to you, Dr. Ford. Thanks for sharing with us.
To all the viewers.
There, a special greeting just for you. Getting into my skin today, focusing on progressive macular hypomelanosis.